So for the next part of this lecture, we'll be talking about PANNET or pancreatic neuroendocrine tumors. Now, these are rare compared to the tumors of the exocrine pancreas. They mainly resemble the carcinoid tumors of our GI tract and can be found anywhere. Body, head, or tail yung pancreas mo. It can be found anywhere on the organ. It can be single or multiple and benign or malignant. And very important is that these tumors may express pancreatic hormone. So these may be functional tumors. Now, the behavior of these tumors is pretty difficult to predict based on light microscopic appearance, but Ki-67 may be used to determine the proliferation index. So, pag mas mataas ang proliferation index mo, basically in Ki-67, mga around more than 20%, generally speaking, they may indicate that they may have a more aggressive behavior. For it to be considered as a malignancy, you need to have unequivocal characteristics such as your metastasis, vascular invasion, and local infiltration. But these are quite rare for these types of tumors. Majority of them are benign. Now, for the pathogenesis of these tumors, there are three major genes or pathways involved. One would be your multiple endocrine neoplasm. So, like MN1. So we'll be discussing the familiar syndromes later. Then you may have loss of function mutations in tumor suppressor genes like PTEN and TSC2. And you may have inactivity mutation in ATRX and DAX. And those two mutations are involved, genes are involved in telomere maintenance. So, ang nangyayari is that there is alternative lengthening of the telomeres kapag meron kang mutations in these two genes. So, your first tumor to be discussed is insulinoma causing hyperinsulinism. So, these are the most common pancreatic endocrine neoplasms, and the insulin produced can be sufficient enough to cause hypoglycemia. So, in your patients, what you would notice is that they will have episodes of hypoglycemia in which your blood glucose is less than 50 milligrams per deciliter. So, katulad ng sinabi ko kanina, yung nangyayari sa mga pasyente na same lang yung manifestations, pero it can go so bad as to cause confusion, stupor, and loss of consciousness. These are precipitated by fasting or exercise and relieved by feeding or parenteral administration of glucose, similar to an diabetic na mayroong acute complication. So how would they look like? They are found within the pancreas, usually benign. This is the tumor over here. The carcinomas are diagnosed based on local invasion and distant metastasis. And note that those are quite rare. If you do electron microscopy testing, you will be able to see granules of beta cells, granules within your beta cells. These are mainly solitary tumors around less than 2 cm in diameter, encapsulated such as this one, with pale to red-brown nodules anywhere on the pancreas. And they look like giant islets with preservation of regular cords of monotonous cells. Malignant cells may also appear well differentiated and encapsulated. Kaya ang pag metastasis talaga, pag malignancy ito, dapat may metastasis ka na makita. In endocrine tumors, actually, majority ganun ang kanyang na kapag meron kang METs, tsaka ka lang talaga matatawagin niya na CA. Deposition of amyloid, such as what you see over here, is quite characteristic for your insulinomas. So this one is another set of stains showing your insulinomas. And this is a glucagonoma, pero we will not be discussing that anymore. Hindi siya kasi ganun ka-common compared to yung insulinomas and gastrinomas. Okay? So, ito yun. If you do Congo red staining, you will be able to demonstrate the amyloid presence. So, islet hyperplasia can also be seen. So, this may result to hyperinsulinemia. They are more commonly encountered as congenital hyperinsulinism with hypoglycemia among neonates and infants. So, the following clinical scenarios are what causes islet hyperplasia. Maternal DM, Beckwith-Wiedemann syndrome, and rare mutations of the beta cell potassium channel protein or sulfonylurea receptors. Clinical features of insulinomas, hypoglycemia, kung meron man is mild, except in 20% of cases, so talagang masama. Critical laboratory findings, should be able to detect high levels of insulin and a high insulin to glucose ratio. Treatment would have to be surgical removal of the tumor, in which once you do that, hypoglycemia is reversed promptly. And you have to make sure that you have to rule out a lot of differential diagnoses such as absolute abnormal insulin sensitivity, diffuse liver disease, inherited glycogenosis, and ectopic production of insulin by some fibromas and fibrosarcomas. Another tumor noteworthy is your gastrinomas seen in your Zollinger-Ellison syndrome. So you may be able to recognize this from your GI lecture. So in this condition, meron kang mataas ang gastrin secretion mo, causing hyperacidity in your patients, and that's causing usually peptic ulcer disease. So the tumors is likely to be seen along the duodenum, peripancreatic soft tissues, and in the pancreas. Cell of origin is not agreed upon, but it may likely be the gut or the pancreas. Okay. So, if you're going to check for clinical features, ang importante lang dito, intractable peptic ulcer formation. So, kahit anong treatment mo, balik yung peptic ulcer disease ng pasyente mo. So, pag ganun, magrinig na dapat ang bells mo na, baka mamaya may gastrinoma ang pasyente mo. How do you treat? Number 1, you need to control the gastric acid secretion using your HK-ATPase inhibitors, and of course, you need to excise the neoplasm. If meron ng hepatic metastasis, ibig sabihin, this is a malignancy, a life expectancy is going to be shortened in your patients. So how would they look like? So this one is your gastrinoma over here. Yeah. More than half the gastrinomas are locally invasive or have already metastasized at the time of diagnosis. 25% are associated with your MEN1 condition. If you're going to check it, under the microscope, these are histologically bland and they may rarely show marked atypia, as you can see over here. Okay. If this is part of the Zollinger-Ellison syndrome, you will be maraming yung peptic ulcer formation. Okay. Even along the duodenum and your stomach, you will be able to see ulcers. Other rare pancreatic endocrine neoplasms, I'll just go over them. You just need to be familiar. Ang importante kasi is that these are functional tumors. So, if your patient is manifesting effects of hyper secretion ng certain hormones, consider always na baka mamaya a tumor is the one causing these problems. So, you have glucagonomas, delta cell or somatosastinomas, VIPoma, carcinoid tumors, polypeptide secreting endocrine tumor, and your multi-hormonal tumors. Now, note for multi-hormonal tumors, this just means that you have a tumor that is producing more than 2 types of hormones. Hindi siya, iba yung MEN syndrome. In MEN syndrome kasi, marami kang hormones na pinoproduce kasi marami kang endocrine organs na present at any given time. Okay? And with that, we'll be ending your endocrine pancreas. Up next, we'll be talking about exocrine pancreas.